thank you for the invitation, and I'm glad to be here. The work I will present today is actually also a review, so we had heard about many reviews today. So we conducted a review because we were interested in the technical aspects, actually, how cognitive behavior therapy elements are implemented in terms of techniques or technological solutions in e-mental health applications. So we just heard on the previous presentation that we have rural areas where it is difficult to get access to mental health treatment. We also have a global shortage of mental health professionals. And, well, in particular, the pandemic did not help with this solution, with this problem. So there is a need to support people or to deliver mental health treatment, even if we don't have direct access to health professionals. And one idea, one possible solution that was tested in the last couple of years a lot are mental health apps. So applications running on a mobile phone that people can use independently from having access to a psychologist, for example. So we conducted a literature review with the objective of finding out how cognitive behavior therapy is realized in mHealth apps. So cognitive behavior therapy, we heard about it today already, is some kind of therapy that is applied in people with mental health a lot. So, and we wanted to assess which technologies are used in mHealth apps to implement cognitive behavior therapy techniques. Then we were also interested in which mental illnesses have been studied with this kind of apps. Then which technologies are used to implement the different techniques of cognitive behavior therapy in mobile health apps. And we wanted to identify research gaps that currently exist in mHealth apps for realizing cognitive behavior therapy. So we searched databases, three databases, PubMed, IEEE Explore, and ACM Digital Library. So the last two are rather technical ones. PubMed, it's more medical related, and we searched with keywords related to cognitive behavioral therapy, mental health, telemedicine, mobile health, mHealth, and smartphone. We explicitly excluded publications concerning internet-delivered interventions. So what we just heard in the presentation before, we really wanted to focus on applications that are smartphone-based. So in our synthesis, we included finally 34 papers after some filtering and selecting of papers. So I'm coming directly to the results. In terms of study characteristics, we found out that most of the studies that were included in these 34 papers were reporting about randomized controlled trials where these mobile health apps has been tested. There were a couple of other study designs used to study mental health apps, but they were not that much frequently. There were a few surveys, 4 papers reported about surveys in this context. What you can see here as well is that the average number of participants is, well, medium size, I would say 300 for randomized controlled clinical trials, but the range is quite big. So there are randomized controlled trials involving 30 participants in the trials and up to more than 1,000. Then, as I mentioned, we were interested in the mental health conditions that have been assessed with mental health apps, and we found out that most studies support persons with depression, so most apps that have been studied support patients with depressions, so almost the half of the papers. But there were also other diseases studied. So, for example, studies related to anxiety disorders, addiction problems, or psychiatric disorders. And now, from a technical perspective, the important or the interesting things. So we were focusing on 4 techniques related to cognitive behavioral therapy, which is cognitive restructuring, behavioral activation, and problem solving. And actually, there's a 4th one I have not on the slide because we did not identify any technique for this, but I will mention it later on. So we found technologies that implement these 3 techniques from psychotherapy. So regarding cognitive restructuring, we, for example, found implementations of diaries in mobile health apps. I think that's most straightforward. We can just keep our diary on the mobile phone and don't have to take notes on paper. Also taking notes about emotions and things like that have been implemented in mental health apps. Then in terms of behavioral activation, we found mobile health apps that provide information. Also, this is quite obvious. Also, running self-assessment. So they had mental health apps where people can assess their whatever depression scale or whatever in these apps. Goal setting is one technique that is implemented, and also tracking and monitoring mood or behavior, and as well as activities. Then related to the topic of problem solving, these mental health apps sometimes provide specific activities or exercises to deal with the mental health problem or with the emotion, and they also provide kind of homeworks. So I did not include the numbers here. You can read this in the paper. There are also some applications that enable the user to have a direct communication with a therapist. So it's supposed to be a support for the therapeutic process, but there are also some mental health apps that are independently from any therapist contact. Now I'm coming to the concrete technologies. So we found out that interactive elements implemented in these mental health apps are most prevalent. What do I mean with interactive elements? So this means, for example, automatic question answering. So as a user, I can ask questions to the system, for example, to a chatbot, and the chatbot will answer my questions. I can also exchange messages with the treatment team, so this direct communication we found, and we identified personalization methods that were mentioned, and also mental health apps that implemented virtual characters. So maybe this is interaction with a human, as people recognize this is important in this kind of treatment and in the context of mental health. Then we found additional technologies that are implemented. So chatbots is one aspect, so that I kind of have someone I can talk to about my problems, and the chatbot is providing some exercises or some solutions or some information to help me in my situation. Interestingly, we identified the social aspect that was implemented in these mental health apps. So there were social aspects integrated, which enables the user to connect with other users, for example. And this is interesting because mental diseases are often characterized that people are, for example, for depression, people are isolating themselves, so they feel lonely, or also other mental diseases where people feel lonely, and with these social aspects implemented in mental health apps, researchers obviously try to overcome this isolation process and this loneliness to facilitate maybe through this virtual world to connect to other people. Also, we found gamification elements implemented in mental health applications. And regarding, so I mentioned that emotions or the mood is tracked and monitored. And here we found sentiment analysis techniques included in these applications. So to summarize the principal findings, mHealth apps for cognitive behavior therapy basically exploit two groups of technologies. So we can distinguish, on the one hand, technologies that implement the actual treatment, so the actual cognitive behavior technique for cognitive restructuring, behavioral activation, and problem solving. So these three I mentioned. And on the other side, we found technologies that rather support the user experience, adherence, and also engagement. So we separate these two groups of technologies because the one is rather the evidence-based, so the methods for cognitive restructuring on all these things. This is basically based on clinical evidence, so techniques that are used in clinical practice already. And the other ones are specific for this implementation of these techniques on the mobile phone and, being the user alone interacting with the system. Here we have the fourth method I was missing. It's exposure. So this is a fourth cognitive behavior therapy technique, and we could not find any papers that used exposure in a mental health app. So we were just hypothesizing that this might be too risky to expose the patient with his fears or whatever when he's in an uncontrolled setting at home or in whatever situation. We found a trend towards use of interactive elements in these mobile mental health apps, gamification, and technologies for social interactions. That's what I mentioned before. What are the potentials of mHealth for cognitive behavior therapy? So they basically allow to support in repetitive tasks. So when I'm asked as a patient to keep a diary, I have to do this continuously, and the mobile health app can support me in doing this because my paper-based diary never sends me a reminder, but my mobile health app can send a reminder and can encourage me to keep the diary, for example. So it also facilitates digitalization of current paper-based tools. So sticking with the example with the diary, not sure whether it's useful from a clinical perspective or psychology's perspective, but I know that already keeping the diary is something related to the therapy, but maybe the therapist is also interested in changing in the changes that happen over time. So it would be useful to kind of access the diary, but maybe the patient does not want that the psychologist reads everything, but maybe we can apply some kind of topic analysis or trend analysis, and so just show the psychologist the trends and to allow monitoring on a lower level. Just some ideas. More engaging, I mentioned this already, an improved patient experience and adherence because of the gamification elements we can implement in these mobile health applications and things like that. Another potential is that it's maybe easier to integrate such mental health, mobile health applications into the daily life. So I can have my psychiatrist in my back pocket, if I like it. So I have access to support every 24/7 hours a day. And well, my last point here is access to evidence-based information. Of course, people are using Google and whatever search engine to get information about their conditions on whatever. But with mental health apps or mobile health apps, we can ensure actually when they are good built and when we ensure that also experts and professionals in this field are involved in the development process, that we are only providing evidence-based information. And so this would be some positive effect on the patient. So what are the challenges? When we look into app stores, we find a lot of mobile health apps related to mental disease. So it's not called mental health apps. They are labeled like wellness and health and well-being apps, something like that, to avoid it, whatever. People maybe get afraid of using them. So these apps that are published in app stores are often published there without running any clinical trials. This is a problem because people are just downloading them and we cannot be sure that patient safety is ensured or whatever. Maybe the information is not evidence-based, it is integrated in the application. There are no solutions implemented to when people are running into critical situations, in particular when we consider depression as what is the topic here. Maybe they have some suicidal ideations and the system is not recognizing this and is not able to react in an appropriate way. So this might become risky. Another challenge is that, so my point here was that we need to run clinical trials before actually putting these apps into app stores to ensure really that there's no patient harm can be created. Another aspect is that, as I mentioned, we have did not found anything related to exposure. So I'm pretty sure that also maybe other techniques are not realized in such mental health apps. So maybe there are limitations in terms of to what extent we can deliver cognitive behavior therapy through these mobile health apps. So we are also missing clinical trials studying actually the effects of the different technologies. So most of the apps integrate different kind of technologies, so gamification and diary keeping and whatever. So a couple of technologies, but at the end we don't know which technology has which effect. And this would be very helpful in order to really build helpful, useful, good mental health applications. What else is here? So when having mobile apps, we cannot be sure what other apps the patient is using. So there might be app interactions coming up. Then app-internet interaction is kind of related. So maybe I use another internet-based intervention and I'm using something on my app and they make different suggestions or have different approaches from the psychologist perspective. So maybe they are conflicting the kind of therapy. So I probably also would not go to two different therapists at the same time. Then a study of adverse outcomes. So we just did a quick search about adverse outcomes related to some technologies. And in clinical trials, we almost found no evidence of adverse events related to mobile apps. Maybe it's because we, from a technology perspective, we are not aware what could happen. Maybe we are too optimistic about technology use. So so maybe when I have my virtual friend on my mobile phone, I don't have to talk to other people anymore. So we don't know, and it's not reported as adverse event because how should the people, the patient, know that this is an adverse event, and things like that. And we also would suggest some meta-analysis to really learn more about the different outcomes and different adverse events. Also, addictive behavior might become an issue here, so I maybe become addictive to my virtual psychiatrist. We don't know. So, open issues. We recommend that more research on integrated, or what they call nowadays blended care models, has to be done. So in particular, how to integrate these kind of tools and technologies into the care process. So not just leaving the patients alone with selecting the tools, so how to make actually also recommendations about mobile mental health apps that could support the care process, the treatment process, and how to well integrate it. So when you're using it to support the therapy, maybe the therapist is supposed to do something about, or ask at least from time to time how it goes with that. Then I'm not sure whether there are still studies, but we did not find any about the economic value. Does it have some economic value? But only because when we found some economic value, health insurances will be willing to pay for the apps. So developing apps is not for free, I can tell you. And of course, providing. So my initial point was that providing mental health treatments through a mobile phone, or we heard that in the internet-based treatments, is supposed to overcome inequalities or to help people who probably don't have access to mental health treatment, but we still don't know maybe we exclude people by providing mental health treatment through mobile health apps. Like we exclude me from driving the bus in Tromsø because I cannot pay by the app. So, and my last point is, we have to ensure quality of mHealth apps, and what the recommendation here is to really use a participatory design, which becomes very popular nowadays, or co-creation, where we involve the users, the potential users, the health professionals, the technology people, and maybe it's also time to involve some people who think about ethics in this context.